I'm Nadya Swart for Contours, and it's a privilege to be speaking with Dr. Miriam Grossman. She's a child psychiatrist and one of the most, if not the most, iconic vocal critics in a very censorious landscape against transgenderism and the gender ideology movement that's been consuming our societies. Dr. Grossman, thank you so much for your time.
It's great to be here with you. Thank you.
Gender ideology, it's actually still a little bit of a weird concept. What does it mean? Versus sex, for example.
Oh, well, sex and gender are two separate things, completely separate. They are being conflated at this time. They're being used as synonyms, but that is a mistake. They should not be. Sex refers to whether someone is male or female, and male or female are biological categories, and they are based on whether a person's reproductive system is designed to produce either eggs or sperm.
Mm-hmm.
So even people who, for example, might have some medical or chromosomal issues, who are not fertile and who do not produce eggs or sperm, their system is still designed around one of those. Is designed around the potential of producing either eggs or sperm. So everyone is, from the moment of conception, either male or female. Now, that is sex. And it has a tremendous bearing on really nearly everything about us. So that there is, for example, a new specialty in medicine it should be called sex-specific medicine. It's called gender-specific medicine. And it refers to the study of how every system in the body is impacted by chromosomes and by the hormones testosterone and estrogen, and it has an impact on how we process pharmaceuticals, drugs. It has an impact on disease. Men get certain diseases more commonly than women do. We react differently to infection, to also, to severe burns, for example. So there is a massive significance to whether a person is a male or female. But now gender is a word, a pretty recent word. Okay, it was first used gender identity was probably first used in the 50s to refer to a certain feeling or an inner experience of being male or female, or being a girl, a boy, a man, or a woman. So it is divorced from biology, and it has to do with something inside that can change, that is fluid. Gender ideology says that gender is more important than sex. That when it comes to who someone actually is, that it's their gender, their emotional experience, their inner experience of themselves, and how they are perceived by the world, that is more important than their biology.
Can you give me examples of how deeply entrenched gender ideology has become in Canada, the States, just in the educational sector specifically?
Well, it's very entrenched, not only in education, but in the medical profession, in the mental health profession, in government. and obviously in entertainment and online and clearly. So to give you an example, um, in the United States and Canada, we have something called gender affirming care. And that is the predominant um, narrative. That is the predominant approach that's being used for young people who have some distress about their sex, about being a boy or a girl. And gender affirming care instructs people like myself, all medical people, teachers, parents, everybody really, to immediately accept a child's chosen identity. So, regardless of age, regardless of whether that child may have emotional difficulties, um, we are supposed to at once use the new name that that child has chosen, the new pronouns, and essentially endorse this new identity. So when the child comes to his parents and says, I'm not a boy, I'm a girl, I'm in the wrong body, and the parents are advised to accept that and to call the boy by a new name, it is an endorsement of that child's misperception. No one is born in the wrong body. There is no such a thing. There's no medical basis for that.
Mm-hmm.
There's no medical basis for what kids are being told, little kids, that it's possible, for example, to have a boy's brain in a girl's body. That simply is not possible. We know that from before birth, the fetus embarks on, 99.98 of babies. Okay, there's a very, very small percentage that fall into the category of what we now call intersex. But we are talking about 99.99%. So we know that they, from actually 8 weeks post-conception, a time when many women are not even aware that they're pregnant, that baby is already, if it's a male with a Y chromosome, producing testosterone. And that testosterone travels all over the body, the tiny, tiny fetus body, and including to the brain. And that from that moment, that fetus is on a male trajectory. Now, for us to be telling small children that sex is assigned at birth as if it is some sort of a random designation that is made by a doctor or a midwife or nurse that happens to be there when the baby is born, it is simply, there's no basis for it. And it is a dangerous idea because it leads children to think that, they're told, in fact, that sometimes the adults make mistakes and that only you know what your sex is, what your gender is. And so you can decide and you can experiment and, you can go and sort of see what it's like. And they tell kids, in fact, and these are mostly vulnerable kids that are become victims to this, kids that have pre-existing psychological issues. So kids who are on the autism spectrum are very vulnerable to this ideology. Kids who have anxiety and depression. And what they're told is that, the reason that you're struggling and the reason why you're having trouble making friends and feeling good about yourself is because well, it might be because you were born in the wrong body. So this is a suggestion that's put out to them, and it's put out as a solution to their distress. So the kids will hang all their hopes on this, and they will get convinced. Of course, there's, online, there's so many places that they go to on YouTube and on social media and different websites that are going to enforce the idea. But not only that, Nadya, it enforces as well the idea that if there are people in your life that don't support this and don't support your new identity, those people are toxic. Those people are non-inclusive, are transphobic, are biased. Essentially, they're bad people. And that's why I say that this ideology is destructive, not only to individuals who go down the path, but to their families.
To begin with, I mean, when a child is 4, 5, 6 years old, they're still learning the difference between this is grass, this is the tree, this is green, this is blue. Now they will be confused about what they had just become comfortable with knowing as this is a girl, this is a boy, when they are asked at preschool what they'd like to be addressed with. What does this do to the psychological makeup of a child that young?
Well, what we want in child development is for kids and teenagers and adults to have a strong identity. Mm. Because a strong identity means that you know who you are. Mm. And you have a strong sense of yourself.
Yeah.
And that is healthy. That is a goal of development. So this does the opposite. This introduces the identity, the possibility that you may not be who your body says you are. So it introduces a split between the mind and the body, which is so distressing and so much undermines the idea of developing a stable identity. It is a destabilizing idea. And so we see that kids do become very anxious and do show sometimes a change in personality. In the kids by and large that we're seeing now, the vast majority of them who have gender dysphoria, which is the term for this severe distress with your body, they are teenagers, or they are just coming into their teen years. And what a lot of parents describe, because I see these kids in my office and I talk to their parents, and pretty much all the parents will describe that there is a change in the child's personality and a change in the way that they relate to their family members and other people that they were previously had a solid attachment to. And so there is a destabilizing effect, and there is the effect of, just questioning everything in their lives right now. They may have always felt that their family was great. Their parents were good parents, open-minded, accepting, good parents, loving parents. And now suddenly, and they'll tell me, my patients will tell me this, I always thought my parents were great, but now when it comes to this and they won't call me by my new name, they won't respect who I am, my authentic self. They won't respect that. They disrespect me. They misgender me by still calling me their daughter instead of their son. And the kids are taught to believe that that is the highest, most deepest level of disrespect and dehumanizing. They feel they're being dehumanized by their parents. And, Nadya, I can tell you that these parents are the most loving and devoted parents that you will ever meet. And they will do anything for their child except deny reality.
Well, that's what's, I think, happening very often. And I've seen couples actually split up about this because one parent will go with it because they are so desperate not to lose their child because they see that it's sort of hanging in the balance. But how do you, your book, Lost in Translation, which, by the way, I just have to say is an absolutely great title. Yeah, recent book. And it's a guide to parents out of the madness of what they're being bullied into.
It is a practical guide for parents and others, anyone really who has a child in their life, or anyone whatsoever who needs to understand what's going on in the culture and how there's been a crusade of this belief system. I call it a belief system because it's more like a religion.
Yeah.
It's not based in science or in medicine. And the book is a practical guide. It's not for professionals. You don't need a PhD to read the book. It has many, many practical elements. For example, I have model conversations that a parent can have with a child on this issue. I have a model conversation of a parent can have with a teacher or a therapist or a pediatrician on this issue. Now, I have a number of appendices at the end of the book, and one of them is written by an IT expert, and it's a guide for parents to get control of your child's internet use. You must get in control of your child's internet use. And there's, with filters, there's all sorts of, I don't understand this stuff because I'm not a computer person.
I don't speak computer either.
Yeah. Okay. So that I could never have written that. So I found the most highly qualified person who presents all the different possibilities that are there for parents on how to get control of your child's social media and internet use. You must do this because I promise you that there are many, many people out there. They're in chat rooms, and I'm talking about adults, older teenagers that are out there, and they're on chat rooms, and they're looking for kids like yours who are innocent and vulnerable. And I've had one family after the next come to me in which their child was recruited online. And it's a problem. So, you want to be on top of this before your child comes to you with the announcement. So really, any parent with a child of any age will benefit from my book. I also have information that may not exactly apply to South Africa, but it might in large part. I have an appendix about schools and one also about child protective services. I would imagine that you have similar things there, similar issues with schools. I'm giving people the heads up, and I'm telling parents that, this is like a minefield, and you have to know where you're stepping. You do not want to step on one of these mines.
I mean, what's happened culturally and societally? Because you said that the term or the concept was introduced in the 1950s, but it feels like this movement has really just swept the world for the last decade, 2 decades maybe. What's behind it? Because it seems with most things like this, there's usually, you would assume, a goal to confuse people, to make them vulnerable, to, I mean, if you use the word recruit. What are your thoughts on who's driving this?
Well, of course, that's always one of the questions that comes up. So, I mean, before I give you my speculation, I'll just say, look, I mean, I'm a psychiatrist, so my focus is on individual kids and families. You're asking me for the bigger, view from higher up, on top of it. And I can tell you that I believe that this is coming from the left, and that the goal of the extreme left is that there should be chaos in our society. It's about breaking down,
Fracturing.
breaking down the norms, and breaking down, obviously rejecting our Judeo-Christian tradition, and just going into a chaotic situation. And we can see now the chaos. I don't know what's going on in South Africa, but here, when your daughter goes into a public restroom, there could very well be a man in there.
Yeah. And it'll be legal.
Yes. When you go to a public, a pool or a gym, or there could certainly be boys and men in the changing room, in the showers.
Yes.
So, that leads to chaos, and the confusion now of what's happened to our language, that we could spend a whole hour, Nadya, just talking about our language and how the word woman, mother, all of these terms now are being co-opted, or you could even say colonized. That's the word of the moment. These words, women are being erased. Yeah. Women are being erased by men.
Do you think that that's a big driver behind this whole thing? Because that sounds like a very big reaction to the whole woke movement, which I would assign the transgender movement falling under.
Well, when you look into, for example, I'm going to direct you to someone by the name of Jennifer Bilek, which is B like boy, I-L-E-K. And she has a blog called 11th Hour. Jennifer is the person who's done all the research on the funding and, what you're asking me about. You probably want to interview her.
Okay.
So she has discovered that many of the individuals who are behind the funding, and when I say funding, I mean the hospitals, the clinics, are multi-millionaire transgender men living as women. So yeah, I would suggest that if you're it, definitely you should inform your listeners or your readers about this. It is interesting. There is an agenda. There is a desire to change our world, to create a world in which there is no male and female. To create a world in which reproduction is separate from biology.
This must be difficult, and I applaud you for actually being courageous enough to be a dissenter in this day and age. The fact that you haven't been cancelled is actually quite...
Sure. There's all sorts of things that have happened, but, I'm very grateful for the many people who have given me a platform. I mean, Jordan Peterson Dr. Jordan Peterson wrote the preface to my book.
Yeah.
And I'm so grateful. And he had me on his podcast. And Matt Walsh had me in his documentary, What is a Woman? Did you have that there? Yeah.
I haven't seen it, but I've heard incredible things about it.
So, I have been canceled, but there are many, many people like you who, who want to hear what I have to say and are excited about my book. And Nadya, I really put my heart and soul into this book, Lost in Transnation, because I saw and am seeing so many families suffer and so many young kids suffer. I mean, I have a young man in my practice who, unfortunately, he did have his genitals removed.
But this medicalisation, it's being legalized. And Jordan Peterson, I think it was actually him that said that you lay bare and you expose what they're doing, what they're perpetrating is criminal behavior. How far do you see this going? Do you think we're past the point of no return?
Well, I have to say it's not it's not actually criminal because the medical profession overall has been captured by it. So it there's legislation now in many parts of the U.S. that does make the surgeries and the medical interventions in minors illegal.
Okay.
It's still not a majority of our 50 states, but every day it seems, or every week, there's legislation in another state that is successful. But it's a tremendous battle because you see, it's the proponents of this are very clever, and they frame it within the they frame it as a civil right issue. That that everyone has the right to identify as they wish, male, female, both, neither, and that they have the right to these medical interventions. And the doctors, they're saying do not have the right to refuse, even a minor.
But that's the extent to which it's actually been captured, the medical profession.
So, Dory, you asked me if I thought we have gone to we're past.
Yeah. Do you think that as a society globally we're past the point of no return?
Well, I would say the horse is out of the barn. That is for sure. But I wouldn't say it's the point of no return because I see a lot of change even in the past year. I mean, I started writing about this and warning parents 15 years ago, at which point hardly anybody noticed at all. But now it seems everyone is noticing. And people are saying, wait a minute, what is this all about? What do you mean that we're stopping the puberty of a 10-year-old? We are removing the breasts of a 13-year-old girl. And people are noticing this and they're saying, wait a minute. And in addition, Nadya, what's so great is that countries such as the United Kingdom, Sweden, Denmark, Norway, and Finland, all those countries they made a U-turn.
Okay.
Yeah. So, and they are speaking up. The leaders of gender medical care in those countries are speaking up, and they're saying to us in the United States and Canada, what are you doing? There's no evidence that what you're doing is going to help in the long term. Yeah.
The term gender dysphoria, which we're still allowed to be using, that it hasn't been sort of outlawed as something that's offensive. Because dysphoria, wouldn't it by definition imply a psychiatric condition or illness?
Well, it is a psychiatric condition, it used to be categorized as a disorder, but about 10 years ago, the American Psychiatric Association made the decision to no longer consider it a disorder. And I explain in my book why they made that decision. And I explained that it was based on politics. It was based on having compassion for those individuals who have gender dysphoria and who wish to live as the opposite sex. There are extremely rare individuals for whom that is the only relief that they can find for their distress. Yes, we still use that term. At the time, 10 years ago, there were a lot of people that wanted it removed from the DSM. The DSM is the catalog,
Yeah.
the manual that we use in mental health.
That grows every year or every few years that it gets redone.
That's true. So it's like a directory, so to speak, of mental health disorders or conditions. And so there was an argument 10 years ago to remove it completely because the proponents, the advocates of transgender ideology, believe and want us to see this as just a variant of normal. Some people have blue eyes, some people have brown eyes. There's no disorder in having one or the other. So they would argue some people are okay with their sex, some people are not, and it's not a disorder to not be okay with your sex and to want your body modified. I argue in the book that that is a disorder. To the degree that you want your body I mean, of course, there's a whole range of masculine girls and women and feminine boys. Of course there is.
Yes, no.
You know,
that doesn't mean that you grow up and you think that you're not something that you could possibly know what it's like to be.
Well, you see, that's the thing, Nadya, is that kids are being told that if you don't fit in a stereotypical way, if you're not into makeup and, shopping and cooking in the kitchen, I don't know, ridiculous, stereotypes, well, then you may be a boy. And if you're a boy that's not into sports and not into building things and being rough and tumble, and you like to dance and you like poetry and you like whatever, fashion, you might be a girl. I mean, this is what's going on. This is a terrible thing. So yeah, those kids are very vulnerable. And I tell parents that from a very young age, you have to let your child know that they were either a boy or a girl from the moment of their creation, from the first moment. It's not because a doctor said that they were a boy or a girl. They are a boy or a girl. That's great, and that will never change. And there are many ways of being a boy or a girl. There's all kinds of different boys and girls. So that's important as well.
And then I really have about 30 more questions that I drafted to ask you, but let's rather just close off with this. What's occurred to me, and I find it very, very sad actually, that the extremism of the transgender movement has made many people that see the distortion of identity involved therein very anti, and anyone that's different, they conflate homosexuality with transgenderism, and it's yes, polarized the society, but it's made people are just either incapable of accepting anything different, whereas there are things and human beings that are different, as you said, to the norm. And I mean like a little bit different from the spectrum now. not biologically. but but how can we also, you've been labeled not an anti-transgender activist, someone who justifies the discrimination of certain human beings. How do you respond to that and advise other people who are open enough to,
Well, I mean, that's just ridiculous because I'm not anti-trans. I am anti the suffering that often results from these medical interventions which prevent the real issues that people have, that young people have, the emotional issues. When you focus on modifying the body, you lose sight of the emotional issues that are going on. And that's what so many of the detransitioners say. The detransitioners are young people who have been through the affirmation process and they have had their bodies modified, and then they realize that they regret it and that the underlying issues that they had all along, the depression, the autism, the trauma, has not been addressed. And so they now still have those emotional issues on top of a whole list of medical issues. So what I want is for these young people to get the compassionate treatment that they need. I want them to recognize that we are all mosaics of male and female. We are all a mixture to a certain degree, more or less. That certainly can change throughout life as well. I went through a period of about 10 years when I didn't even own a dress or a skirt.
Been there.
No, we go through different times in our life and we change. And to make these permanent changes that are irreversible and that may lead to, they can lead to infertility, permanent infertility and infections and all kinds of horrific things on the basis of a feeling, no matter how sure you are. Kids can be sure of a lot of things.
Yeah.
And this is why we don't permit them to get a permanent tattoo until they're adults, right? Because they may regret it.
Yeah.
So I am not anti-trans. I want these young people to stay whole and healthy and well. And I want them to maintain their ability to have biological children when they're older. To lose that ability, to lose the ability to nurse is a huge loss. It's a huge loss. And young, I would say anyone under even 25 is not in a position to make these kind of decisions. Furthermore, we have no evidence that the medical and surgical interventions are saving lives. We have no evidence that the suicide rate changes. In fact, it may be worse on the other side.
Yeah. This is what you testified at Congress this year. It was that the misinformation being spread to parents who were so afraid that, for example, their children will commit suicide. It's just driving this whole acquiescence to just go with it.
Well, it's emotional manipulation. And it's irresponsible, and it really has to stop. They have to stop. The parents have told me, almost a lot of the parents that have come to me, they first went to a gender clinic and they were told, do you want a dead son or a live daughter? And parents will do anything to save the life of their child. So, but again, we don't have that data. We don't have any data that indicates that not intervening, that providing psychiatric care instead of medical interventions like hormones, puberty blockers, and surgery, we do not have evidence that increases the suicide rate. Yeah.
Dr. Miriam Grossman, your time really, it's so valuable. Thank you for sharing these last 40 minutes with me. I'm Nadya Swart.